There was a television show called Nurse that came on.
I became a nurse because of my maternal grandmother's experience with colon cancer.
My family influenced me. I had a lot of wonderful female role models that worked in healthcare. Primarily my mother who's a pharmacist.
My third grade teacher said, you'd make an excellent nurse. And that really stuck with me.
I really wanted to be at the bedside and really help people during very vulnerable times in their lives.
Found nursing, but more importantly, found out about the role of the nurse practitioner. So that gave me the opportunity to build relationships with children and their families and be a part of their physical and their emotional growth.
I wasn't sure what I wanted to be at 10 years old, but I knew I wanted to do something that was going to help people. I found nursing later in my career, but I'm so grateful that I'm where I am today.
So I feel like I've kind of come the full circle, if you will, from practice, teaching, research, and now back to helping to try to lead in all of those areas as well.
Nursing for me is really the opportunity to be able to make a difference and to make a change, especially as we age.
My mother ended up she's the go-to pharmacist, so all the nurses went to her with their questions about medications and dosing.
Just watching the process that she went through, interacting with medical, surgical nursing, and even home health nursing, I fell in love with the profession.
I'd always wanted to be a school teacher and thought that's where I was headed until I got to watch that show and realized how much nurses cared for their patients, the critical thinking and fast actions to save lives.
I get to teach as a nurse. I still practice as a nurse practitioner. I'm the chief diversity officer here in our College of Nursing. I feel like I'm at a place where if I can dream it, we can do it here.
Ohio State has helped me by opening up opportunities that I would have never thought was possible. So you can be a nurse scientist and pursue what you love, but also really get back at helping patients and impacting healthcare.
The Ohio State University has helped me to answer the calling to care by the opportunities that it creates to connect with, to work with, to be inspired by internationally, nationally, and locally renowned researchers.
By being able to give back to my community, particularly African American older adults, because quite frankly, we're all going to get older, we're all going to age. And if I can do something to make it better now, then I know that my future will be better too.
We really do have the best and the brightest. And here within the College of Nursing, there's such a depth of talent and interest and resources.
Two things that really resonated with me was culture and support. So the culture here is so collaborative. It's amazing, the people that I'm working with.
Just the positivity of this work environment, the ability to really think big, and to know that you've got infrastructure around you to support big ideas. I continue to say that if we can't change healthcare at OSU, I'm not sure who can.